subscribe and follow to get more other slides. Right now we're going to go through the thorax. So the definition of the thorax is that region of the body that is located or extends from the neck and abdomen. So it is the part of the upper trunk. Remember, the body is divided into two. We have what we call the upper trunk and the lower trunk. So the thorax is part of the upper trunk, and it extends from the root of the neck to the abdomen itself. So that is the thorax. So the thorax, it communicates with the neck, and it is separated from the abdomen via the diaphragm. The diaphragm is just muscular. It's made up of muscles. It's the one that separates the thorax from the abdomen. So you're going to see the lines of orientation of the thorax. So this gentleman right here, he has been projected, and together with all the lines, we have what you call the mid-sternal line. That is what we call the mid-sternal line. The mid-sternal line, it runs vertically downwards over the sternum in the middle of it. That's why we call it the mid-sternal line. It lies along the median plane, and it moves over the sternum in the middle aspect of it. So that's what we call the mid-sternal line. So we're going to go to the mid-clavicular line. Just like the way the human body is divided, it has two clavicles, the right and the left clavicle. So the mid-clavicular line is that line that runs vertically downwards in the middle of each clavicle, in the mid of the clavicle, the middle of the clavicle. It runs vertically downwards through the middle aspect or the midpoint of each clavicle. And this one right here and right there are what you call the mid-clavicular lines, the right and the left side of it. So we also have the anterior axillary line. For it, it runs vertically downwards from the anterior axillary fold. In comparison, or in contrary, we also have the posterior axillary line. So for it, it just runs vertically downwards from the posterior axillary fold. So I'm going to illustrate more. Then we have the mid-axillary line. For it, it's a vertical line that is in between the anterior and the posterior axillary folds. So we can clearly observe this when a person raises up the hand. That is when the armpit is clearly observable. So let me try to draw something over here. So this is the region of the armpit. This is the head with the hand being raised upwards. These are someone's hands. This is the anterior axillary fold. This is the posterior axillary fold. So in the middle of it, we have the mid-axillary line. So the anterior axillary line runs vertically downwards from the anterior axillary fold. So this is the anterior axillary line. The posterior axillary line runs vertically downwards from the posterior axillary fold. Then the mid-axillary line that runs in between or in the middle of the axillary folds, the anterior and the posterior axillary folds. So right now we are going to see the posterior aspect of the chest wall or of the thorax, and you also have lines over there. Actually, you have a line. It's called the scapular line. Just like the way the human body is made, you have what you call the right and the left scapula at the back side. So the scapular line runs from the inferior angle of each scapula vertically downwards. This is the inferior angle of the scapula. This is also that region over there, inferior angle of the scapula still. So the scapular line just runs vertically downwards from the inferior angle of the scapula. Allow me proceed. We have the formation of the thoracic wall. What makes up the thoracic wall? The thoracic wall, posteriorly, we have what you call the thoracic vertebrae. The thoracic part of the vertebral column is the one that makes it up on the posterior aspect. So now when we view the anterior aspect, we have what we call the sternum and the costal cartilage. Just remember the ribs, they are attached onto the body of the sternum via the costal cartilages. So on the anterior aspect, we have what we call the sternum together with its associated costal cartilages. Then on the lateral aspect, this side and the other side, this is what you're going to see. We're only going to see the ribs together with their intercostal spaces on both sides, on each side of the thoracic wall. Those are the ribs together with their associated intercostal spaces. So they border what we call the thoracic wall on the lateral aspect. Now let us go to superiorly on top. Superiorly, we have what we call the suprapleural membrane. Somewhere over there. The suprapleural membrane, or what we call the Simpson's fascia. So it is this Simpson's fascia. Remember, the apex of each lung projects upwards in the root of the neck, and it is covered what we call by the suprapleural membrane or the Simpson's fascia. So superiorly on top, it's what you're going to see above, right there. You're going to see the Simpson's fascia forming the superior aspect or the superior border of what we call the thoracic wall. And inferiorly, we have what we call the diaphragm, which is just a group of muscle that borders what we call the inferior part of the thoracic wall. So now we are going to see the intercostal spaces. The intercostal spaces are the spaces that are in between the ribs, in between two ribs. So we have 12 ribs in the human body. So the intercostal spaces are n-1. That is 12 minus 1, meaning that there are 11 intercostal spaces. That is on each side of the thorax, the right and the left side. So each intercostal space is associated with structures of a kind. We have the external intercostal muscle, internal, then the innermost intercostal muscle. We have the endothoracic fascia, parietal pleura, the intercostal vein, intercostal artery, and the intercostal nerve. Oh my God, you observe this area over here. I think it's clearly visible. Let me zoom it. That is where you're seeing the intercostal vein, the intercostal artery right here, and the intercostal nerve that are in this space where you're seeing in the intercostal space. Then we also have the parietal pleura, the endothoracic fascia. The parietal pleura is also clearly visible over there. Together with the muscles. So now we are going to go through the openings of the thorax, that is the thoracic inlet and the thoracic outlet. So the thoracic inlet. So the thoracic inlet, or what we call the superior thoracic aperture or the superior thoracic apparatus, it forms what we call the thoracic inlet. Then the inferior thoracic apparatus forms what we call the thoracic outlet. So you're going to observe, we're going to go through the thoracic inlet together with all the boundaries, together with the structures that are passing through. So the thoracic inlet is just it communicates. It's a communication that is in between the root of the neck and the thoracic cavity. So it communicates with the root of the neck through a narrow opening that is called the superior thoracic aperture or the thoracic inlet. It communicates. It's like a communication in between the thoracic cavity and the root of the neck. So obliquely, it is facing upwards. The line is not straight. It is obliquely facing upwards. And the reason for being that it is oblique is that the upper end of the anterior boundary lies 1.5 inches below the upper end of the posterior boundary. And because the first rib slopes downwards and forwards from its posterior end to the anterior end, so therefore the plane of the thoracic inlet slopes downwards and forwards with an obliquity of about 45 degrees. So that's why it is just an oblique line. The way you're seeing it, it is slanting like that. Then boundaries of the thoracic inlet on the posterior aspect, we have the first thoracic vertebrae, the T1. Its body, the body of the T1 forms the posterior aspect. The first rib is over somewhere there. Yeah, it is over somewhere there. The T1 rib, first making what we call the posterior aspect. Now the lateral aspect, you have the medial borders of the first rib and the costal cartilage. Yeah. The medial border of each of the first rib on each side. The medial border of the first rib, even over there, on each side together with their associated costal cartilages. Then on the anterior aspect, you have the superior border of the manubrium sternum. So this is the manubrium sternum, and its superior border makes up what you call the anterior portion or the anterior boundary of the thoracic inlet. So right now, these are some of the structures that are passing through the thoracic inlet. These are some of the features. This is the manubrium sternum, the superior border of it, making up what we call the anterior portion together with the associated the costal cartilages of each of the first rib on the either side. Then we also have the T1 vertebrae that is located back at the posterior aspect, forming what we call the posterior border. Then we have the middle of the medial borders, the medial side of each of the first rib. Yeah, now let us go through the structures. This pink structure that you're seeing there is the apex of the lung, and I've told you that the apex of the lung projects upwards into the root of the neck. So being the fact that it projects upwards, it is being protected from any kind of injury by what we call the suprapleural fascia, or what we call the Simpson's fascia. So the apex of the lung is also among the structures of the thoracic inlet. So now we also have the trachea, that air passage. We have the esophagus. We have the common carotid artery. We have the internal jugular vein, the subclavian artery, and the vein on each side. Yeah. So now, we also, among the things that you have also left out, we also have muscles all over there. We have the sternohyoid and the sternothyroid. Together they remain with the remainings of the thymus gland. Also among with the structures that pass through the thoracic inlet. This is on the midline. We have what we call the veins, have the arteries, then we have the nerves. Right common carotid artery, left common, right subclavian and left subclavian artery. Then the beginnings of the right brachiocephalic vein and the left brachiocephalic. Like, these structures are located on two sides. So when you mention right, probably and absolutely there is what you call the left. So if it is the right common carotid artery, then there is the left common carotid artery on the left side. So now let us go through the thoracic outlet. So for the thoracic outlet, for it communicates the thoracic cavity to the abdomen. Remember, for the thoracic inlet, it was communicating the thoracic cavity to the root of the neck upwards. So right now, the thoracic outlet is just going to communicate the thoracic cavity with the abdomen. And for it is obliquely facing downwards and forwards, the way you can see it. And for it is being enclosed by what we call the diaphragm, which is a group of muscle. So now the boundaries of the thoracic outlet, we have posteriorly, on the posterior aspect, you have the 12th thoracic vertebrae, the T12th thoracic vertebrae. It is over right there. You can clearly observe it. It forms the posterior body of the thoracic outlet, the 12th thoracic vertebra. Then laterally, we have the curving costal cartilages. They are the ones that form the lateral aspects. Then anteriorly, we have what we call the ZV, the xivisternal joint, formed by the xiphoid process, and what we call the body of the sternum. The anterior aspect is formed by a joint, the xiphoid joint. Then inferiorly, it is closed by what we call the diaphragm, the group of muscles. It's the one that closes the thoracic outlet. So now when we go through the structures that are passing through the thoracic outlet, we have those that are going through the major openings of the diaphragm and those that are going through the minor openings of the diaphragm. They are clearly visible. We have the descending aorta. We have the descending aorta, we have the esophagus, the thoracic duct, you have the azygos vein, inferior vena cava, right phrenic nerves, and the lymph vessels. So this is right here. What you're observing, this is what we call the esophagus, descending aorta. We have the inferior vena cava over here. This is what we call the central tendon of the diaphragm, and this is the diaphragm muscle that covers or that forms the inferior border of the thoracic outlet. So through the minor openings, we have a couple of nerves, arteries, and that are passing through the minor openings of the diaphragm. Have the left phrenic nerve, right superior epigastric artery, left superior epigastric artery, right sympathetic trunk, and the left. Then right greater and left greater splanchnic nerve, right lesser, left lesser splanchnic nerve, right lowest and left lowest splanchnic nerves. So this can give us a better overview of where we can see each of these structures that are passing through the minor openings. There are quite many and quite uneasy to observe on this structure. So this is our lecture. It has been on the thorax. Don't forget to know the thoracic inlet, thoracic outlet, structures that are passing through. They're quite examinable. Then don't forget to know about the formation of the thoracic wall. They're also examinable. So thanks for watching this video. Please don't forget to subscribe, to comment, to share for more videos. Thank you. Good day.